You're still watching the City of Lagos TV show on TV Nigeria. Welcome to Speaking with the SA platform on the program. This is where we speak to very strategic special advisors to Governor Babajide Sanwo-Olu. And our purpose is to promote and project and of course celebrate the very innovative expertise of the special advisors to the governor in diverse perspective, health, politics, and all that. And so today we're going to be speaking with the special advisor to Mr. Governor on health. We're talking about Dr. Mrs. Kemi Oguyemi. Madam, you're welcome.
Thank you.
It's a pleasure to have you on the program. The health sector is a very critical sector, and whosoever, apart from the commissioner, whosoever is a special advisor must be at the top of his or her game, and of course must also be a game changer in terms of offering very useful advisory functions to the governor in the area of health. So who is Dr. Mrs. Kemi Oguyemi? Let's have a precise and brief professional profile of your distinguished self.
Thank you very much, and welcome to the Ministry of Health. So my name is Kemi Oguyemi. My career in health started a few years ago. I studied nursing. I did midwifery, I did family planning, and then from there I went to the UK, University of Manchester. I studied health service management. I got an honours degree there, and then I started working in the UK. I grew into a manager. I was managing wards and actually involved with a lot of policy at the ward level. From there, I moved to Atlanta, Georgia, America, where I was a director in nursing. And then I went on and did my master's in nursing. I got a master's in healthcare administration. And as a leader, I did a lot of leadership courses, administrative, learned a lot about health service and things that just make the health ecosystem tick. I came back to Nigeria. I was also, my area of specialty, apart from leadership, was cancer care. I moved back to Nigeria in 2013, where I set up an NGO for women's health. From there, I got a position at the Bagada Renal Cancer Center as a director of nursing. From there, I now got a position at Health Service Commission, where I was a commissioner on the board of the commission. And Health Service Commission is tasked with recruiting, training staff in all the general hospitals. And so I was a member of the board. It was a full-time job. I did my first tenure, and then I did a second tenure. This current governor renewed my tenure, and it's an 8-year tenure. And after that, I got the position as special advisor to Mr. Governor. In between, I did study for my doctorate in healthcare administration. So it's all been about administration, leadership, and I've learned a lot along the way, and I am in my position now.
Fantastic, fantastic. So now, what are the key fundamental responsibilities of your office as the SA to Mr. Governor on Health? And how far have you brought your wealth of experience to bear?
Thank you. I work alongside the commissioner. I'm a cabinet member, and so we discuss health issues. And I give my opinion, I advise the governor. If he's meeting with certain people within the health sector, I'm there as well, along with the commissioner as well. For the Ministry of Health, we have split the departments. So for me, I oversee the Directorate of Medical Administration and Training. Lasambos, that's our ambulance service. Hefama is an agency under me, and we regulate all the hospitals in Lagos. I also oversee the Directorate of Family Health and Nutrition Children. And so I advise. Also, primary healthcare services are under me as well, ensuring that quality is provided there. So I help to oversee the 6 permanent secretaries over there as well. And so we sit down, we collaborate, we talk about issues, pushing Mr. Governor's agenda, the H in his Themes Plus agenda, to care for every single Lagosian to be able to afford it and to give quality care. So as an advisor, I inform Mr. Governor. He can call me anytime and ask me questions, and I also bring issues to him, and then we deliberate and make decisions together.
All right. Now, from your perspective as a special advisor, what are the significant action policy initiatives, efforts, programs, and projects have the ministry taken to improve the health sector in Lagos?
We've done quite a lot of efforts. Mr. Governor is somebody who is very sensitive to the needs of the people. He wants every single person from the riverine areas, rural areas, to get health to them. So in the past year, the governor divided the whole of Lagos, especially the rural areas, primary healthcare, into 6 districts. And he appointed permanent secretaries. The effort is because Lagos is so large and we have so many people. So the whole idea is to ensure, so you have a small segment, somebody is leading it, to ensure that each area, each local government gets the best possible care. So, and I meet with the permanent secretaries regularly, and that way they can give us data. Data allows us to make decisions, informed decisions. We have so many social determinants of healthcare, transportation, lack of money. So the permanent secretaries run with this. They ensure that our agenda, our policies are out there and everybody can hear it, basically. I'll give an example of another program that we've done for the first time ever. We did Alafia Eco. Mr. Governor, he was thinking about it, he brought it to cabinet that our people are suffering, they want food, what else? So we decided on Alafia Eco, where he sought it fit to fund a program where we give free medical care, basically. And everybody that came, medication for 4 weeks. So in other words, you do not have to pay for anything. We gave free eyeglasses to those who needed it. We did blood pressure, HIV tests, and it was a huge success. And that's for him to reach out to people that, you know, this is a caring government and this is what we want to do for you. Maternal and child health indices are not where we want them. We're still losing children. So he matches some of our international partners' funds. He gives us approvals to, for example, family planning, to ensure that pregnant women get the best care. As I'm talking to you right now, pregnant women receive antenatal care for free, and delivery is also free, be it normal delivery or cesarean section, it's free. So we have all these programs all out there. It's just a matter of people reaching out, and because we do have a caring government, Ministry of Health is working very hard to ensure that the care they also get is safe. It's of quality, it's affordable, it's accessible. We're building a big Massey Children's Hospital, the biggest, I'm sure, in West Africa, and it's going to be well equipped. We have more PHCs coming up. We're building another general hospital in Ojo. And so every single area within the points where people are, we have a lot of people, Mr. Governor is there ensuring that all these things are being done.
Thank you very much. Now, what is the level and nature of synergy between your office, the ministry, and other relevant agencies and parastatals to achieve your set objectives? Because there must be some level of collaboration and synergy, really.
Absolutely. And health cannot stand on its own. Even in the Themes Plus agenda, you know, it's health and environment. So I'll give you an example. So we had the cholera outbreak. There was no way Ministry of Health was going to handle that themselves. It's all about the environment. So the Ministry of Environment was involved. They were stakeholders. So we had meetings with them. We come together. It's so important. Education, for example. We have colleges of nursing, of health, part of how we're trying to combat the Japa syndrome, where we have less doctors, nurses, health professionals, basically. We are setting up a new University of Medicine and Health Sciences. We can't do that without the Ministry of Education. We go to schools to ensure that children are immunized and they get all their eyes checked, their ears checked. We cannot do it without education. It's still health. So housing, if people don't have good housing, you know, they fall ill. houses that, obviously physical planning, building, when they collapse or they're not built well, they end up coming here. So they're linked. We're linked a lot with different ministries. So we're not in isolation. We're not on our own, but we're all strategic. Environment, home affairs, what's going on around the infrastructure. We all work together. So infrastructure, for example, we're building roads. There's so many, and you soon see the many commissioning of different roads. As they're building these roads and commissioning, at the back of their mind, health. We always, as soon as, even in cabinet, somebody says something like health components. There seems to be a health component in virtually everything.
Health is a very strategic sector that needs extraordinary funding.
Oh, yeah.
So is there an existing international collaborators or partners and the private sector here, and as well as the federal government?
The government can't do it alone. Absolutely not. I mean, we only take a percentage of the budget. And as you know, everything is going up now. Our drugs are expensive and all that. So we do collaborate with international partners and even local partners as well. So I'll start with the international partners who are interested in things that happen in Africa as a whole, things that happen in Nigeria. And one thing about Lagos, because we are a center of excellence, is anytime there's a special program and they want data or they want to help out internationally, Lagos is always part of it because that's where you get so many people together. So for example, the Bill and Melinda Gates Foundation, we're working with them a lot. They match what Mr. Governor puts in there. I always tell people that when you hear something is free, somebody is paying for it somewhere. There's no free lunch. So if we offer free services, the government is paying for it. Our partners are paying for it. We also have Clinton Initiative, Health Initiative, USAID help us as well. Private sector, 60% of our citizens actually go to the private sector for their services. So they are so important to us as well. And Mr. Governor recognizes that as well. So we have PPP schemes that we do. We're setting up an oncology comprehensive center, which hopefully in the next year or two. So there's a partnership, there's an MOU outstanding with a private firm. We also have that in, for example, Massey. There'll be some areas where it's a PPP arrangement. We have some of our MCCs, whether it's radiology, whether it's diagnostic, it's a PPP partnership. We have cath labs, we have MRIs and all that. It's all PPP, but it's part of LASUF. It's the only way we can bring those services, quality services, to the citizens. So yeah, we're ready to partner. It just depends on what you're bringing to the table. Specialist medicine is coming in. We'll probably have more as we move along. It just depends on what it is that we want to do.
Essay, judging from what you experienced in foreign countries, looking at the way the health sector is operated, and coming back home, looking at what we have locally, where are those slight pitfalls that are still existing? And as a special advisor to the governor, what have you done to try to fill in those gaps in order for the health policy initiatives to have the expected positive impact?
So I've worked and I have licenses in the UK as well as the US. They also have their issues. Yes, they're an advanced, would say they're developed countries. US, for example, is one of the largest healthcare systems. It costs a lot of money. They have to get the money from somewhere. And they also have issues. People still complain about the system. People complain about the NHS. They practice socialized medicine. They had to close down a lot of hospitals to look at how they can save money. So one of the first things I found when I came back was that there was a lot of duplication. And people were working in silos. A lot of silos, it was, for me, it was pretty strange in that. So when I went to the Health Service Commission, it was like, okay, but if you're doing this and you're doing this, who's doing this? I mean, you're not talking to each other. So communication was huge. And even in your ordinary life, if you do not communicate, things will not be effective. One thing at our last ESCO meeting, we do this, we call it shift talk, where each member will give a talk just to encourage and inspire others. And the Commissioner for Youth and Social Development said one about vision. And at the end, Mr. Governor said something that resonated with it. He said, you can have vision. You have to have vision. He has vision on what he wants Lagos to be like. But then with that vision, he has to have a strategy to get to that vision, right? And he said, strategy without execution is hallucination. So if you've got the talent, the skill, or whatever, you showcase yourself, you become valuable, then you'll be picked. That's exactly what Mr. Governor looked at. So when I went to the Health Service Commission, I realized that we need to come together, we need to continue having meetings, we need to agree, even though we will disagree, but we'll come, and then we have one person, one thing, one theme, one strategy, and we execute it. Because it's all good meetings. We had lots of meetings and nothing will come out of it in the end. So I kind of I want to say I changed that a little bit. Customer service, I realized that in both countries, UK and US, that I'm familiar with, every single person, including the CEO, had to have customer service training every single year or 2 years. It was part of the evaluation. So I tried to introduce that. It took me 2 years. So there's some challenges which I won't go into. Eventually, it's part of what we do because there were lots of complaints that people coming to the hospital and people are not helping them and they're rude to them and all that. And which was one of the reasons why some people do not go to our maternities and labor ward in the hospitals because they feel they're not treated right. And when I came to the ministry, it was a little bit, I would say a little bit like that. So I had the ministry and then the agencies. So you had primary healthcare, then you have secondary healthcare, and everybody was doing their own thing. And it's like, okay, and good things, smart people doing things under certain challenges where we do not have enough staff. So I have regular meetings. Whatever we do here, primary healthcare has to know we are the supervisory ministry. We are in charge of every single agency and all the other ministries under Ministry of Health. They need to know what we're doing, what we're saying, and we need to know what they're doing, and we need to follow up. Yes. So, and that's what the commissioner and that's what we've brought in. That this is how we work together. If we do not work together, it's not going to work. And I want to believe that I've been in this position for a year. I want to believe that things are improving. I know things are hard out there, economic situation and all that, but we are really, really trying.
Let's look at the future healthcare plans. As a special advisor to Mr. Governor, are there future healthcare plans and initiatives for Lagosians?
Oh, absolutely. And it's ongoing. There has to be a future. There has to be a plan. There has to be either an immediate plan or long-term plan and all that. And then we work to achieve that. So one of our, I would say, immediate and long-term, it comes together is capacity building and increasing the number of healthcare professionals. We're losing quite a lot of them. We're really short-staffed. I mean, there's no denying that. We're short-staffed. So, and that's why I mentioned about the University of Medicine and Health Sciences, where we're hoping at least we will train 1,000 doctors, 1,500 nurses, 1,500 pharmacists, medical scientists. And this will help us because then if people want to go, we will not be short-staffed. We'll still have some people that will stay. It will also improve the quality of training and the education that we're giving people. And so that is starting. We just need it to be passed at the House of Assembly, and then we start. With that, obviously training the ones that are here and trying to improve their welfare.
We'll be speaking with the essay to Governor Babajide Sanwo-Olu on health, and of course, with a level of professional expertise, you've also heard her. She's been able to bring something on the table. And what she has brought on the table is to create a very cohesive, functional and dynamic health team. which of course has given the supervisory ministry, which is the Ministry of Health, to other agencies, that urge to deliver on the Teams Plus agenda of Mr. Governor. Now, let's say there are challenges. What are the current challenges faced to sustain healthcare delivery? I mean, considering Lagos as a cosmopolitan city with a huge population, I know it's a uphill task to bring an appreciable level of Lagosians into that dragnet, health. So what are the challenges and how are you able to mitigate against them?
Yeah, quite a few challenges. You can look on the government side and then you can look at the people side. Let's start with let me say government first. You rightly said it, we're densely populated. The Institute of Migration said 3,000 people come into Lagos every day. Even I couldn't believe that. That's a lot. That's a lot on our services, be it education, be it health, transport, security. There's a lot of pressure. So what we're trying to do, so picking on that, is that we want people to register. And that's why we have LASRA. With LASRA and the fact that we've divided the primary healthcare into 6 districts, we want to get data. So is District 1 looking after a lot of elderly people? Does District 2 have a lot of pregnant people? So that way, and what's the age, the demographics, basically. That will let us make informed decisions about how we spend our money to where. So, because right now it's all equal.
Are you doing something in that regard, data gathering?
Oh, absolutely. Alafieko gave us a lot of data, so we know which areas and now we're even, we just had a meeting before this interview on trying to get data to where do we have the more pregnant women, how many do we have in the riverine areas, because we keep on saying rural, riverine. How many people do we have there that are pregnant that need emergency care? So we're looking at that for us to be able to make those decisions in terms of financials, economics. Where do we want to build another hospital? So that's one challenge. 2 is that we have people who are homeless. They don't have any fixed addresses. They don't have anything. I'll give you an example. We had the cholera outbreak and it was free. Treatment was free because it was an outbreak, because it's past a certain level. And some people will give us wrong addresses. We don't know where they are. Some people live under the bridges. They build houses under the bridges. So there's some also environmental factors that actually affect us. But most importantly, for me, from my point of view, is that we have to keep on creating awareness. Some people, I don't want to say they don't care about their health. So we keep on having to tell people that whatever it is that's a priority will not happen if you're unwell. So we're trying to push towards prevention rather than cure. So prevention is cheaper for us than cure. It's cheaper for the individual than cure. So we're working with kings, obas, churches, the pastors, the mosques, the imams. All of them are traditional birth attendants. They are stakeholders. We sit down, we let them know this is what's going on. Prime example, immunization. All of a sudden, from COVID, we have a lot of anti-vax people, even from church, actually going out there. They've got lots of funding to say, do not take vaccinations. They took us to court. The judgment went for them, but the judge said, Lagos State should not give anybody immunization without parental consent. We've never done that. We've always gotten consent. Lagos was the only one that was taken to court to say, no, tell them to stop it. Well, we went ahead and we did it, and we even got more people than we expected. So we've got the people factor who are pushing us away, but we're going in their space and saying, this is for your benefit. You have to take responsibility for your benefit. And that comes with, it's just a melting pot. Everybody has all their different ideas.
Quite interesting. Quickly, before we go, where you're coming from, talking about your foreign background, before you came to Nigeria, there's an aspect of taxation. People tend to pay some level of tax. I mean, fulfilling a civic responsibility. But here in Nigeria, I think we're having, thank God for President Bola Ahmed Tinubu, because he is a tax expert and he's been able to try to reinvigorate that tax spirit, So for health to get the desired impact, some or people need to just pay their tax.
Absolutely.
So, are you doing anything with regards to this in terms of enlightenment, sensitization, so that people can get what they're, paying for?
You've just said it all. That's what we do. So when we have programs and we say we'd like to do more, but people are not paying their taxes. Have you paid your taxes? So we just mentioned it because we're not the tax department. I know LIRS is doing a lot and they send out forms. The SA for tax revenue is also doing the best that they can, but people are not paying their taxes. Now, can you imagine those who live here? They want security, they want good roads, they want fantastic hospitals, they want good schools, but they're not willing to pay taxes, but they're making money because this is the business center. Well, it's the same thing as Ilereko, Lashma, health insurance. I mean, we haven't even gotten a quarter of the people that are in Lagos. And that's why the governor made an executive order that everybody has to have health insurance. You can have your private health insurance, but so in the same vein, like I said, when we have programs and talking, we can just say, please pay your taxes. It will help us with the hospitals and all the things that they need. So we can only continue to say it and just encourage and make people aware the reason why it's important to pay the taxes and the benefit for them. That's why they're enjoying Lagos right now, because of the people that pay their taxes.
How would you describe the support given to the ministry so far by the governor?
Oh, a lot of support. I mean, we're not the only ministry in the government. So he's pulled, I mean, I don't know how he does it, but he does. He has to look at all our files. He asks questions. He's extremely supportive, extremely supportive. He doesn't want to hear things like outbreak, disease affecting people or anything like that. So Mr. Go-Getter, Mr. Say it and do it. Mr. Compassion, he's a listener. You can't be a good leader if you're not a listener. You've got to listen to what the people want. So he's a caring, compassionate, very, very intelligent. Doesn't just do anything just like that. You've got to show him data. And if he's paid for something, he's like, what did you do with that money? Did it help? If it is helping and he sees it, he will continue it.
Finally, as the essay on health, what's your word of assurance and encouragement to Lagosians, health experts, and of course, international organizations, collaborators, partners, with regards to delivering on the governor's mandate?
To Lagosians, I would say, you know what? That saying that health is wealth is not an understatement. It's the health of a state, of a nation, of a country is part of what makes that state or country or nation successful, economically viable. So it's so important to look after your health. This government, this Lagos is a center for excellence. And in the Ministry of Health, we have excellent people, smart people working for you, doing the best that we can. But we cannot do it alone. We just ask Lagosians to also take some responsibility and meet us halfway. Let's work together to make Lagos the best that it can. And to our international partners, continue to partner with us. We are collaborating with you, private practice, everybody. We are together. We welcome you. We will work with you to help Lagos be what Lagos should be, the center of excellence, and to sustain that excellence and let the good people of Lagos know that they can trust and rely on their government. Thank you.
Dr. Mrs. Kemi Oguyemi, thank you for coming on the program. I want to really appreciate you for the very wonderful job, bringing your wealth of experience to bear. Looking at Lagos is a very, I call it a strong city where Absolutely. You have diverse, professionals, people, ethnic, religious that have different mindset and mentality. But I think you've tried to break the ice, Wonderful. Yes. I wish you all the best.
Thank you very much.
Well, that's it on Speaking with the Essay on the City of Lagos TV show.